Past the hour, the Biden administration has declared monkeypox a public health emergency as cases continue to rise across the U.S. Health and Human Services Secretary Xavier Becerra released a statement that reads in part, "We're prepared to take our response to the next level in addressing this virus, and we urge every American to take monkeypox seriously and to take responsibility to help us tackle this virus." The World Health Organization issued a similar declaration last month, calling it a global health emergency. More than 26,000 cases have been reported in nearly 100 countries. Some cities and states have issued their own emergency declarations, allowing them to free up funding and resources to help respond to the outbreak. Joining us now, Dr. Ashish Jha. He is White House COVID Response Coordinator. Thank you very much for being on with us this morning. What do Americans need to know about warning signs or prevention with monkeypox, and how prevalent is it? That 26,000 cases, what does that mean in the grand scheme of things? How dangerous is it? How easy is it for it to contract?
Yeah, good morning, and thanks for having me on. And those are fabulous questions. So let's talk about what we know about monkeypox. This is a virus we've actually known about for 50, 60 years, so it's not a novel virus. We've got about 6,600 cases here in the United States. Thankfully, no one has died of this disease. Obviously, we're going to hope that serious illness remains low, continue to do everything we can to make that happen. Right now, about 98% of the cases are among gay and bisexual men. Spreading through prolonged skin-to-skin contact. So it is not something that I think the average person needs to be concerned about contracting. Contracting. It's not easily spread. There's a theoretical risk that it can be spread through surfaces, but that's not what we're seeing. Right now, we're really seeing almost all the spread happening through prolonged skin-to-skin contact.
Jha, I was hoping you could respond to some of the criticisms that have been put towards the Biden administration as to the response to this outbreak, including that the supply of monkeypox vaccine will be limited for months after officials waited in too long for the maker to process enough vials. Also, that there has not been enough targeted communication to the community most impacted by this, and that it has been slow to use its public health emergency powers.
Yeah, so let's take each of those topics. They're all important issues. There is one small Danish company that makes all the vaccines for the world. We have procured more vaccines than the rest of the world combined. So we have been on this really from day one. Do we wish we had more vaccines? Of course. But there's one company, and right now what we're working on is expanding their manufacturing capacity, bringing some of that manufacturing capacity right back home to the United States, working with manufacturers here to expand vaccine supply. I think in the weeks and months ahead, you're going to see a substantial ramping up of that, and we'll have more vaccines coming. You know, in terms of communication, early in the pandemic, or not pandemic, sorry, early in this outbreak, what we saw was, again, it was spreading in the gay and bisexual community. We reached out immediately to that community, started having conversations, seeing what they were seeing, communicating more effectively. That has been a really important partnership for us moving forward. You know, in terms of the public health emergency, what public health emergency does is it gives us some new tools. And we have been ramping up testing, treatments, and vaccines from the beginning. The Secretary of Health and Human Services, Xavier Becerra, Secretary Becerra, made the decision that now declaring a public health emergency gives us more ability to speed up vaccines and treatments. And I think the timing of that was appropriate. Again, I want to remind people, very important, we want to be on top of this thing, 6,600 cases, thankfully no deaths. And our goal is to continue being, kind of one step ahead of the virus.
Dr. Jha, let me ask you about the pandemic and COVID. As you know, thanks to these vaccines and the boosters that have followed, a lot of people just psychologically feel okay getting on with their lives. If you go out this summer, you rarely see a mask. You do see some, but people really have moved on in many ways. And yet we do have this highly contagious subvariant and some concerns about what may be coming in the fall. It's just a couple of weeks. A lot of schools across the country will reopen. How should parents, how should school administrators, how should Americans be thinking about COVID as we enter the fall?
Yeah, so it's a great question about COVID. The way I look at it is a lot of Americans are not, it's not as prominent on people's minds. A, that's a good thing. And B, it's because of all of the work we have been doing in this area, right? Because of vaccines, because of treatments, we've been able to lower the death rates of this virus substantially. And that has meant that it's not as deadly as it was 2 years ago. I think that's, again, all good stuff. But as you said, we have BA.5 out there, highly contagious. If you've not been vaccinated in a while, high risk of breakthrough. If you were infected 6 months ago, you probably don't have much protection against reinfection. Really important for people. If anybody over 50, if you haven't gotten a vaccine shot this year, really important to go out and get one. In terms of schools this fall, I've got 3 kids who are going back to school this fall. What I say is the goal here, and very clear, let me be very clear about this, every kid back to school, full-time, in person. That should be our only standard. That should be the standard that we are judged against. We should be able to accomplish that. We have the tools and capabilities to do it, and I'm very confident we're going to be able to pull that off.
All right. White House COVID response coordinator, Dr. Ashish Jha, thank you very much for all of that information this morning.